Welcome to Straight Outta Health IT. Getting into health tech is rough, but here's an unfiltered dialogue of healthcare leaders and influencers covering a wide variety of issues affecting healthcare and the health tech industry. And now your host, Christopher Cunny.
Hello, everyone. Welcome back to another episode of Straight Outta Health IT. I'm your host, Christopher Cunny, and we are here to explore the intersection between healthcare, technology, and innovation. I'm happy today to have a conversation about an important topic that is on everyone's minds these days, and it's around all about price transparency in healthcare. What is price transparency for those who may not be familiar with it? It really refers to the availability and accessibility of clear, upfront information about the costs of medical services, procedures, and treatments. This really includes the price patients pay and what they might be expected to pay out of pocket, as well as any negotiated rates between healthcare providers and insurance companies. And ultimately, the goal of understanding price transparency is that patients can make more informed decisions about their healthcare and understand what the financial implications might be. To really help us unpack this topic of price transparency and give us more insights around it, I'm so thrilled to have on the program today Dr. Jonathan Kaplan. And Dr. Kaplan is a board-certified plastic surgeon and founder and CEO of BuildMyHealth. Dr. Kaplan has been a trailblazer and empowering patients and providers to navigate this often murky waters of healthcare pricing. Welcome to Straight Outta Healthcare IT, Dr. Kaplan.
Thank you so much for having me. A lot has changed since we first talked and booked this podcast. We've gone through a name change. We started out with Build My Bod back in 2011, but then we became Build My Health, as you mentioned. Exactly. And now we've evolved into DrWell by Build My Health. And in addition to doing price transparency, we are also, I don't want to say pivoted because we're still doing the price transparency, but we are also a platform that helps. We're basically creating a new space. Instead of a direct-to-consumer platform, we're now a provider-to-consumer platform. So we can talk about all of those things. Yeah. I explain what all that means.
Absolutely. I definitely want to jump into that as well as a part of the conversation. So we got a lot to cover in a very short period of time. So let's start, first of all, with the basics. Price transparency in healthcare has been really a hot button for years. And I'm just curious, Dr. Kaplan, I gave a dictionary version of price transparency. Why is it so critical today in healthcare? Why is it so important for us to understand and navigate this issue around price transparency?
It's just so crazy that the only sector within the economy where you don't know how much things cost is the thing that's probably going to cost you the most. And that's no coincidence that one of the biggest causes of debt in America is medical debt. And so within healthcare, and we didn't start out this way to obfuscate the public and not tell them how much things cost. It's just things have evolved here, and that's why we have this kind of crazy healthcare system is just evolved in that.
But is that really true? Did we really not want the public to not be clear on what it costs?
I think that it was really back in the day where there was the county doctor or the country doctor that they would maybe barter and like the price wasn't the issue because the patient would pay whenever they could and we needed to take care of them. But then technology came about where things just really got expensive. No matter how you look at it, it got more expensive. And then these third-party payers, the insurance companies came in, and just that evolution got confusing. And once you started to disconnect the consumer from the cost of it, because there was the insurance company, because you used to pay in the insurance company, pay out the benefits, they would pay the doctor, they pay the hospital, pay out the whole amount. But then the patient didn't really worry about the cost. But then that's the problem is that the insurance company started paying the provider less. They started doing more cost sharing and you had these deductibles. And so like you thought you had health insurance, but why am I still paying $60 to just see the doctor in the office? Oh, there's a copay. You say you cover my GLP-1, my weight loss medication, but why is there $1,000 copay when the name brand drug costs like $1,300 out of pocket? I'm still paying $1,000. And I mentioned the GLP-1s because that's actually what our platform is doing now is one of the things that as a direct-to-consumer website, a patient will have easy access to medication. So we're increasing access, which we've always wanted to do. But the problem is after they got access to medication, they still only had a relationship with the website. So what we're doing at DrWell is we're taking that technology that makes it easy for the consumer to get access. We're putting it in the hands of a provider so you can still sign up for weight loss meds or erectile dysfunction medication or anti-aging medications. But now instead of you having a relationship with the website, you've actually got a relationship with a provider. And so you've got that continuity of care.
Sure.
So that's what we're doing within our platform now, but still pricing and price transparency is still critical to make sure the patients know how much it's going to cost up front. Now, through our platform, they're paying out of pocket, but it's much more affordable than the name brand drugs because specifically with the GLP-1s, the weight loss meds, they are so expensive that even the insurance companies don't want to pay for them. And you're statistically unlikely to get insurance coverage. And I've also noticed that insurance companies will say they cover it. And that goes back to that example. You go to I'm covered. You go to the pharmacy to pick it up.
Right.
And it's $1,000 out of pocket. Exactly.
2/3 the cost of the medication.
Exactly. So are you really covering it? So whenever you see statistics that I saw one statistic recently that insurance companies were covering it only like 23% of the time. And now this year they're covering it 44% of the time. That sounds great. They're covering it, but it's not in actuality real coverage. It's like saying they cover it, but they still maybe make you do a 6-month jumping through hoops, diet and exercise program before they'll consider it. And in the meantime, they're hoping you'll quit that job, move to another job, and they won't have to bother with it at all. Or as we've mentioned, the copay is just crazy. But anyway, as far as price transparency, the way it all started with me is that as a plastic surgeon, we were doing cosmetic procedures, but also people would want to know how much their deductible was for any reconstructive procedures we were doing. And it's just when a patient calls the office to ask the cost, that can take a really long time to explain all that. And I realized that there wasn't a good, easy way for patients to figure that out. And this is back in 2011 when I was an employed physician at a hospital in Louisiana. And since I was an employed physician, I told them I had to tell them because it was their intellectual property, basically. I said, I've got this idea about price transparency so people can at least check pricing on cosmetic procedures. And if you think about how resistant hospitals are now to price transparency in 2024, even though it's a federal law now.
Sure.
Think about how resistant they were back in 2011. And they got this employee that's trying to blow the lid on this whole price opacity thing. So anyway, so they said, you know what? We don't want to support this. And if you want to go off on your own to do the price transparency thing, go for it. So they signed over the intellectual property to me as an employee. And so we started out as price transparency in healthcare. So we would put a price estimator on the provider's website. The consumer would come to the website. They would click on the different things they're interested in, whether it was insurance-based for them to find out. We could do real-time eligibility. They would find out how much they were going to have to pay out of pocket before their insurance really kicked in, or it could be a cosmetic thing where it was totally out of pocket. But the difference was with our price estimator, rather than just a menu of pricing, is that the consumer had to put in their contact information first before they got that instant gratification of that instant automated email with a breakdown of pricing. So it wasn't like this thing where, oh, thanks for your information, we'll call you with pricing. It was like the patient actually got the pricing is sent immediately to their email. And then in return, the provider got the patient's contact information. So it was lead generation. And that was my way of thinking that we can coax providers into providing pricing if they get something in return, like a lead. And some of them were into it, but they were still not terribly interested in it.
It's interesting. It seems like a no-brainer, right? Why wouldn't you want to let people know what the upfront cost is for some sort of service or procedure so that they can make more informed decisions? And there's a greater likelihood that you might get them as a patient as well, too, if you're being very transparent. And you had mentioned we've got federal regulations in place like the hospital price transparency rule that many healthcare organizations are still, quite honestly, struggling to implement. And I'm just wondering, why is it so hard for a healthcare organization to tell a patient, how much is it going to cost to have a procedure in my hospital or in my clinic?
First thing is they don't always know how much it's going to cost. Certainly the person at the front desk at the office doesn't really.
Yeah. It's an estimate.
Sure, of course, no question. But so I think part of the reason is they don't want to do it. And there was even it isn't the case anymore. But initially, when in 2022, so just to back up, the No Surprises Act was passed at the end of 2020. It was implemented at the beginning of 2022, and there were these different transparency and coverage rules that were implemented and rolled out in a stepwise fashion. First, that you had to have 300 shoppable procedures on your website, then you had to be at all of them. So initially, and then they talked about how it was going to be a fine of a certain amount per day, which at the max, when they first rolled it out, I know it's millions of dollars now as the fine, but if you weren't compliant, it would total to be like $109,000 per year if the hospital just decided they weren't going to do it. So $109,000 for a hospital is nothing. And Christus Healthcare, based, I don't exactly know where they're based. I know they have a lot of them in Texas, Louisiana, but they had something on their website where they, if to paraphrase, it's like, we're not doing this. We can't give you pricing estimates. Healthcare is too complicated. We're not doing it. That was the paraphrase of it. It was like, well, crazy. Anybody go Google it, you'll find it. So that was the first thing. They didn't want to do it.
Yeah.
But then there is the technological aspect of it. It is difficult. I'm not saying it's any excuse for them not doing it. They've got to do it. But I'm just saying that's the reason. It was one, they didn't want to do it, and two, technologically it is complicated. And initially the government wasn't giving enough explanation of how to do this. They've now provided some more technological coding support, but it does require a lot of overhead on the part of the hospital to roll it all.
Or I guess, how do you run a business if you don't know what your expenses and your income might look like? You don't know how much it costs to deliver a procedure for a patient. You've got historical data from previous procedures that you've done that you could use as a benchmark. And I just struggle a little bit with the excuse that it's difficult. It's difficult for a lot of industries to figure out what it costs. But they don't care what it costs to buy a car. They tell me how much it costs to buy my house. There's a lot of moving parts and a lot of expenses and changes in costs and manufacturing pricing and all sorts of stuff that happens in other industries. Why does healthcare get a pass?
So in the process of giving you a very articulate answer, I want to be very clear that I'm not defending their activities, their actions, but I do think the difficulties are partly that you're giving somebody an estimate, but obviously you don't exactly know what they're going to actually have to be done. Give me a really good example is that somebody can call and say, how much is an MRI? And the hospital may really be able to tell you, okay, it's this much. We have this negotiated rate with this insurance company, your insurance, and we can tell you that this is the negotiated rate. Right. And we can even tell you that with your real-time eligibility that you've got $1,000 deductible, and then the hospital will, the insurance company will pay 80% up to this maximum out-of-pocket expense, and then they'll cover everything. So you could really give them a really good answer. But the problem is the consumer doesn't always know enough to tell enough information to the people at the hospital. So in this example I'm using as an MRI, and this is a real example, that the people show up thinking that this is their price, this is their insurance. And then when they arrive, the hospital realizes that, or at least theoretically, the person they talk to, the patient that they're bringing is a child. And so now you have to put the child under anesthesia to do this MRI because the child is too young to stay still on their own. And so then that opens up a whole nother can of worms of all these additional costs. So that's just one example of why it is difficult to provide a good estimate, because it is complex. Inherently, it's complex, even if people aren't trying to be malicious or dishonest. It is complex that you throw in another wrinkle into it. This child needs an anesthesiologist to come down. And now maybe that anesthesiologist can no longer charge an out-of-network rate. Good, thankful to the Good No Surprises Act. But that's a whole nother thing that there's another cost involved in there with the anesthesiologist. So that's one example of why it really is complex to be able to predict the estimated cost, because you don't always know these other eventualities, mostly because the patient doesn't know to inform you of that ahead of time when you're trying to calculate the estimate. Right. I think that's a reasonable example.
So what I'm hearing here is what you just said is it's the patient's fault.
Touche. I do think that,
because I just take that scenario, for example, and I do want to move on because I know we have a short period of time.
No problem.
I would expect the hospital or the healthcare provider to say, who's the patient? It's not me. It's my daughter, Judy. Okay, give me Judy's birthday.
Certainly. No, right. And that is, and what I can tell you what's going to happen is,
right.
So yeah, I'm not certainly blaming it on the patient, but there is clearly this gulf, this educational gap, knowledge gap that the patient doesn't necessarily know to volunteer something. But based on that example and what you just said, why wouldn't they do that? That's what the hospital is going to do, is they're going to learn from that incident.
Sure.
And then they're going to put another policy up on the wall
to,
like, when you're giving an estimate, make sure that the patient isn't necessarily the policy holder, the insurance card holder.
Exactly.
Find out who it is in there. So that's what the hospital will do. They will learn from that experience, and then they will implement that the next time. Exactly. But that doesn't do you any good if you were the first patient who learned the hard way.
Take the arrows in the back. Exactly.
Now
the doctor has figured it out, right? This was the problem you were trying to address, and you've created a platform now to for all intents and purposes, solve that problem. And correct me if I'm wrong here, but
we're certainly certainly trying to solve it. It does get more complex, of course, when you're dealing with insurance and you're going to a hospital. And even these transparency and coverage rules, they will give you the ability to see what the price is at the hospital, but you don't necessarily know what the cost is for the provider and maybe the lab that's doing the pathology lab testing. So that's why there's other factors in here, but that's why our platform does support the ability for a provider to print out a good faith estimate that does try to pull in all of those factors. For example, a breast reduction, if you're trying to paying for it with cash, we are pulling in the surgeon's fee, the OR fee, the pathology fee to check the breast tissue. So we are trying to think ahead of those things. So that's one aspect of what the platform is doing, is with the price transparency for cash pay and real-time eligibility for insurance-based services. But then the other part of it is we're developing that provider-to-consumer platform to answer the direct-to-consumer platform where there's that lack of continuity of care. And so that makes it a little bit easier for the consumer to know their upfront cost, because it is cash pay on that side of it. It's not insurance-based when people are trying to get access to the compounded versions of GLP-1s because they're less expensive than the name brand and their insurance isn't covering it, or erectile dysfunction medications, or anything that a compounding pharmacy can support, like hair restoration, things like that. So DrWell's got these two sides where it's the cash pay model that is less expensive than having to pay out of pocket when your insurance doesn't cover it, versus giving people more information from the insurance perspective.
Right. So I was going to ask you, what's the secret sauce to DrWell? What can you guys figure out how to do this? And other healthcare systems struggle with this, and you can share whatever you feel that's not intellectual property around that. But also, I'm wondering, is it because of the type of procedures that you're specifically targeting that makes it a little easier for you to, or less cumbersome, I should say, for you to figure out the price transparency algorithm for that as well?
We are definitely trying to emulate the transparency and coverage rules and the No Surprises Act in that implementation of shoppable, or that the concept of shoppable procedures.
Sure.
So non-emergency procedures. And that's really what we're going after, are the shoppable procedures, the things that you can really, that there's less likelihood of a confusing, throwing a monkey wrench into a kind of situation. So an upper endoscopy, which is pretty clear cut, it's the facility fee, it's the endoscopist fee, it's the biopsy fee or pathology fee if you do have to do that. So those are very clear cut examples of things that we can support. And so I don't want to say we're cherry picking it, but we're certainly going after the things that are easier to figure out because they're more confined services, but also the more common services that people are getting. So we're not just cherry picking the things that nobody uses. It's the things that people are typically getting, the colonoscopies, the EGDs, the weight loss meds, the erectile dysfunction meds, things like that. So that's really the secret sauce. We're solving a problem in my mind that can be solved.
Makes sense. So clearly transparency can be a win for all those involved if implemented successfully.
No question.
Being one of the platforms, for example, but the implementation obviously still is tricky, if not challenging, for some organizations. What are some of those biggest hurdles? Why is it so difficult for providers to adopt an effective transparency model, and any recommendations you would make to them, strategies to overcome them?
I think habits die hard, old habits die hard. And I think that so for example, in our platform, I'm a plastic surgeon, so we have plastic surgeons, but we also like med spas. But looking at it from the obesity perspective, every provider in America could be using a platform like this, because whatever they're treating, the underlying cause is probably obesity. So just really quick overview. Sure. If you're an ear, nose, and throat doctor, instead of treating sleep apnea with CPAP, treat the underlying obesity. If you're a dermatologist treating acne, treat the underlying, or a common cause of acne is obesity. An OBGYN that's treating infertility, often cause of that is obesity. So we have providers from all across the spectrum that are using the platform. Specifically, this example is GLP-1s, weight loss, because so much of whatever symptoms we're treating in the underlying cause is obesity. The thing is that the providers that are used to dealing with cash pay, like plastic surgeons and med spas, they get it. But we also have cardiologists, OBGYNs, urologists that are using the platform. And it is a struggle to get them to understand that, yes, we understand for bigger procedures, you're dealing with insurance. But for these types of services, GLP-1s, things like that, that it is actually more cumbersome to deal with insurance. and the insurance doesn't offer and cover it, or the copay is more expensive. Like, people don't realize that paying out of pocket might actually be less expensive than the copay associated with insurance. So that's the struggle that we're dealing with. The obstacle we're dealing with is that a lot of these providers just don't realize that you actually can go outside of insurance. And once the patient realizes it's actually less expensive to go outside of insurance, even if you've got what you think is great insurance coverage, you'll actually save them money in the end. And that's been the biggest struggle, is convincing or trying to explain to those providers that it's really all right to ask for payment upfront for these services. They sometimes think it's illegal for them to get cash pay for certain things. So that's been the biggest struggle for us.
Yeah. So that being said, because I was thinking, is price transparency going to be something more driven by concierge services, concierge medicine, some of these other non-invasive types of procedures? Is that where you're going to see the biggest bang for your buck on that? Or will traditional healthcare organizations that deal with more complex medical procedures, will they at some point embrace this concept and figure it out? What do you predict and see over the next, 3 to 5 or so years in this space?
I think that because the costs, the expenses of technology, the medications coming out, because Ozempic and Mounjaro aren't the last ones. They're going to keep producing even better ones.
Sure.
Because these costs are going to keep going up, that the consumer is going to have to shoulder more of the cost. So I think that so I think that's going to go to more price transparency, not because the insurance companies are going to be sharing it. It's because people are going to be paying out of pocket more for these cash pay services going through compounding pharmacies. I think that's what's going to have to happen, because something's got to give. And I don't think even if the pharmaceutical companies reduce their prices, they're not going to reduce them as much as people want, because they still have to pay billions of dollars to get a drug through the FDA for approval. So there are certain costs that we're just not going to be able to go below that floor. So I think that their consumer is going to be shouldering more of the costs. However, I think that the pricing, and by forcing healthcare to become more of a market-driven entity, the prices are going to go down because of competition. Sure. And I think that the consumer will be the beneficiary of that, except they will still be paying a little bit more out of pocket than I shouldn't say they're going to be paying more out of pocket. They're going to be paying for more services out of pocket.
Sure.
Because the costs are going to be less because of that market-driven competition. And insurance will become more of something that, for the catastrophic episodes, car accident, things like that. Or I think there's going to be a time when people are getting their gallbladder taken out laparoscopically, outpatient centers, and paying cash for that.
Exactly. And I think, to your point, if there is price transparency, the consumer can become a more informed decision maker, and may now opt to have a procedure because now they can figure out how to finance it or pay for it, or maybe because they thought a gallbladder surgery was hundreds of thousands of dollars. And so now I'm just not going to even consider having one right now because I know I can't afford it.
Right.
Versus saying, oh, no, it's really $50,000. Okay, that might seem more reasonable. Let me figure out how to finance that, and I'll have the procedure going forward because I'm now a more informed consumer.
And I think that also, if you compare it to like car insurance, I think
sure.
I don't want people to be offended by that comparison, but your car insurance doesn't cover tire changes. So I think people will be more likely to go and do concierge to make sure they're staying as healthy as possible, so they don't get into that situation where they're having to go to the ER to get their gallbladder taken out emergently.
Exactly. Even more. Now, this has been such an insightful conversation, and time has flown on our conversation. Got to have you back to delve even further into the conversation. As we wrap up, any final thoughts or advice to our listeners, whether you're a provider that's considering strategies around price transparency, or a patient or consumer that's trying to figure out how to navigate the murky waters of price transparency? Any words of wisdom?
Well, certainly for the consumers, I would say that check the pricing on the service before you go and just, for example, if you're getting some type of radiological study, don't go get it at the hospital. That's going to be the most expensive place. Definitely go out to an outpatient facility. It'll be less expensive. Ask about the cash pay rate. I think you'll be surprised that it's less expensive than what your copay probably is. And also for the consumer, don't make the mistake of saying, let's just go ahead and go through insurance, and if it's too expensive, then I'll just pay the cash rate. At that point, it's too late. If they go through the process of submitting it to insurance, then you're going to be stuck with that insurance out-of-pocket copay bill versus the cash pay bill. So you got to figure that out ahead of time. And for the provider's perspective, that don't mistreat your patients the way you wouldn't want to be mistreated. Let them know how much things cost because you would want to know how much that house is before you go to that open house, how much that car is before you go to the dealership, and realize and recognize that cash pay services may actually be the best way for you to stay independent if you are struggling to stave off the hospitals taking you over and acquiring your practice. Then if you have a cash pay business that's not as sensitive to decreasing insurance reimbursement, that might allow you to stay independent, which is ultimately going to be better for the patient, excuse me. Actually, it's going to be better for both the provider and the patient if you can stay independent.
Sure. If any providers or patients or anyone listening to this program were interested in learning more about Dr. or just want to talk to you more about this whole concept around price transparency, how would they reach you?
Absolutely. Dr. Kaplan, DrKaplan at DrWell.com. Or just go to DrWell.com. If you're a consumer, we have a provider finder page there. You can find a provider near you that offers services that are transparent and as far as pricing. But DrWell.com, and that's also where providers can sign up for our platform as well.
Thank you so much, Dr. Kaplan, for sharing your words of wisdom and providing a little more insight on this whole concept of price transparency. It's amazing the work that you're doing in this space. I applaud you for being an individual that's willing to share the cost of their services with their patients. And we wish you continued success in that journey as well. That's it. Listeners, thanks, Tribe. Thank you so much for taking time to tune in to another episode of Straight Out Health IT. If you enjoyed this episode, please share it with others in your network, whether it's your friends, families, or even people you don't like.
Thanks so much for having me. I really appreciate it. I enjoyed it.
You're very welcome. Thanks for being here. Until next time, please stay informed and stay empowered. God bless and have a great day.
Thank you so much for listening to Straight Outta Health IT. We hope you enjoyed today's guest. For more unfiltered dialogue of healthcare leaders and influencers, be sure to tune in next week. For the show notes, transcripts, and resources, please visit Apple Podcasts, Spotify, or your favorite streaming platform. We invite you to give us feedback by reaching out to Christopher Cunny on LinkedIn, just searching for Straight Outta Health IT, and you'll find us. We are constantly having live discussions about diverse topics in the industry.